Hello, I'm Rob Singleton. I'm a neurologist and a neuromuscular specialist. It's the heart of the COVID crisis, but today I want to talk to you about a different pandemic. People are eating more and exercising less, and this has resulted in an exponential increase in both obesity and diabetes, both in this country and around the world. With increased diabetes has come its complications, including peripheral neuropathy, a systemic injury to the very longest nerves that carry sensory information from your feet towards your brain. About half of patients with diabetes will ultimately develop peripheral neuropathy, but many of them will never know that they have this complication until it begins to cause severe symptoms for them. Once neuropathy is well established, it's very difficult to treat, but we've found that the combination of diet and exercise can help to improve both the number of nerve fibers that reach to the skin and their regenerative capacity. The lesson is it's important to discover patients very early in the course of their neuropathy, and that demands sensitive screening method.
Currently, screening for neuropathy happens in a primary care physician's office, and it is very insensitive. A medical assistant asks some questions and tests the ability of a patient to feel a 10-gram monofilament at the foot. We thought there must be a better way. Findings from a one-year pilot study funded by the Driving Out Diabetes Foundation and carried out by our research team was the inspiration for Neurosense, the first handheld point-of-care sensory threshold device for vibration.
Utilizing the results of this pilot study, we based Neurosense on the vibration of the 128 Hz tuning fork.
My first goal was to design and develop a prototype electronic circuit that mimics the tuning fork vibration, but in a ramp-up direction. The device was bulky and not very different than what's already out there in the market. Then an idea popped up in my mind, which was outsourcing most of the components on this bulky prototype to a commonly available smartphone. This instantly reduced the cost by more than 90% and greatly increased accuracy. A peripheral device controlled by a smartphone or a computer application. In March of 2020, we added a Bluetooth transmitter to make the device more convenient for the end user. A month later, we added an artificial intelligence agent which uses machine learning and reinforced deep learning algorithms to perform mainly 3 tasks over time as it's exposed to more data. It tailors the vibration range for the patient based on their biometric data for a more rapid and convenient diagnosis. It also learns diagnosis of the specialist and is able to provide feedback on the severity of the neuropathy to each patient, so no doctor will be needed for the diagnosis in the future. And finally, it provides useful research data on the population at neuropathy risk. The device uses a transducer to convert an electronic signal to vibration. The signal is transmitted using a Bluetooth transmitter, and there is also a charging protection circuit for the 18650 battery. The device has a 3.5 mm audio female adapter in case someone wants to use it with a wire and without a Bluetooth and a battery. So far, we have filed 2 provisional patents to protect the intellectual property of our device. Overall, compared to the existing technologies, our technology is more cost-effective, accurate, reliable, robust, smart, ergonomic, and very convenient.
Complications of diabetes attributable to neuropathy are the second most expensive complication of diabetes-related health expenditures and the most expensive in aggregate. As of 2015, more than 30 million individuals in the United States have been diagnosed with type 2 diabetes. This large and growing demographic at risk for neuropathy worldwide offers a poorly served market for improved neuropathy diagnostic screening. More than 240,000 primary care physicians see patients in more than 100,000 clinics. If market penetrations were 20%, and each clinic required 3 Neurosense devices to meet the needs of multiple patient rooms, this suggests an initial U.S. market of 60,000 devices. The market for peripheral neuropathy medical devices is growing globally and is estimated to reach over 294 million by 2025, with a nearly 4% compound annual growth rate. We have the ideal team for carrying this project to completion. We combine the expertise of a neurologist, electrical engineer, and a research coordinator skilled in interacting with diabetic patients. Neurosense is straightforward, inexpensive, and greatly needed in primary care. The sooner an effective screening device is introduced, the sooner we can prevent more patients from experiencing the pain and suffering caused by neuropathy.